This is Menopur. Menopur is a medication that we're going to have to mix, okay? So when you get your box of Menopur and you open it up, you're going to have 5 liquid vials and 5 powder vials. Each powder vial of Menopur is 75 units. You will only need 1 liquid vial, and depending on what your dose is, it will tell you how many powder vials you need. So if your dose is 75, you're going to need 1 powder vial. If your dose is 150, you're going to need 2 powder vials. So what you're going to do is you're going to take your liquid and your powder, and these both have caps on them. You're just going to pop them both off. And as long as you don't touch the top of them after you've taken the caps off, you do not have to sanitize them. But if you'd like to, by all means, you can wipe them with an alcohol swab. Menopur comes with these fun little things that help you mix the medication called a Q cap. So you're just going to peel the paper off of this, and you're going to push this directly onto the liquid vial. Then you're going to take your syringe and there's usually about 2 milliliters in here, but anytime you're mixing any medication, you only need 1 milliliter of liquid. To make it easier to take the liquid out of the vial, I always recommend putting air into the vial first. It just helps to equalize the pressure and it makes it easier to withdraw the liquid. So I need 1 milliliter of liquid, so I'm going to put in 1 milliliter of air. Just twist that on, inject the air, then you're going to flip it upside down and you're only going to withdraw 1 milliliter of liquid. You're going to then snap the Q cap and the syringe off of the liquid vial, and you're going to take this and you're going to go right onto your powder vial. This dissolves almost instantly. So you're going to inject the full amount of liquid. It dissolves pretty quick. If you do see some little white flecks in there, you can give it a swirl. Once you see it's all dissolved, you'll flip it upside down and pull it all out until you get a bit of an air bubble there. And that just ensures that you have all of your medication out of the vial. Then you're going to twist off your Q cap and your Menopur vial, and you're going to put on your injection needle. And I always recommend just pushing up until you don't see any air in the syringe, and then you're good to do your injection. So area for injection is the abdomen. You're going to stay 1 inch away from the belly button. So this will be the skin. Clean it with an alcohol swab, let it dry. Take the cap off. Pinch the skin, and you're going to go in at 90 degrees and inject the full amount. Once the full amount has been injected, you're going to wait 5 to 10 seconds, and then you're going to pull it straight out, and then you're done with your Menopur. If your dose ever increases and Dr. Victory wants you to use, say, 150 of Menopur, all you're going to do is take your 1 milliliter of liquid, snap that off. You're going to go to your first powder vial, inject the full amount of liquid, mix, make sure it's dissolved, flip it upside down, pull it all out, snap that off, and then just take what you've just mixed and go right onto your second powder vial. Inject it all, swirl, flip it upside down, and withdraw. You can mix up to 7 vials of Menopur with the same 1 milliliter of liquid.